join me every Saturday. We're texting each other in the morning. Are you ready to go? It's great fun. So that's in my life. Okay, so what do people do when they have stress? Most people react to stress. So we want to change that and respond to stress. So by reacting, meaning either eat poorly or not sleep or not exercise or have other problems. These are the things you could do in terms of responding to stress. Mindfulness meditation, mindfulness and mindfulness meditation, or other types of meditation, guided imagery, yoga, acupuncture, massage therapy, aromatherapy, and exercise, and see what works well for you. Some of you may have used either exercise as a modality or acupuncture. Try something else. See what works for you. Exercise is very important for good health for everybody, and especially important for people with HIV to avoid that frailty, like as you grow older, to avoid disabilities. It's very important, and choose all types of exercise, such as endurance exercise, strength training, balance training, like yoga, where you do certain balance poses, flexibility, like in yoga. Okay, so let's just spend a minute or more, or around a minute, doing a brief meditation. And take a deep breath in. Breathe out. Open your eyes. That was just a brief meditation. There's various types of meditation. It's just a basic one. The next thing is the relaxing breath, and we'll just do one. I won't do all of them. I won't repeat them. In this, you're just going to take a deep breath in through your nose, and you breathe out through your mouth with your mouth open. And there's a count. As you're breathing in, you count to 4, and you hold your breath to count of 7, and then you breathe out to a count of 8. That's it. Okay. We'll start. Take a deep breath in. 1, 2, 3, 4. Hold your breath. 1, 2, 3, 4, 5, 6, 7. Breathe out through your mouth. 1, 2, 3, 4, 5, 6, 7, 8. That's it. So this is just a basic relaxing breath. I have seen innumerable amount of times patients' blood pressure drop with just doing a few of these breaths. And I can now, with the electronic blood pressure monitoring, I can actually show the patient the blood pressure change from the before and after within minutes. So it's very cool. It's great feedback to the patient. So practice this.
Biofeedback?
Yeah, it acts as biofeedback. Yeah.
I want you to know the dog was even meditating.
Okay, nice.
And it shoots.
Right. So this I can't go over in detail. There's a lot of information here. This is a diet I recommend. So I'm trying to stay somewhere in between. People ask me, is it vegan? Is it paleo? Is it this? Is it Mediterranean? No, I have to modify it based on what I've seen in my practice. And this has seemed to work in the last 2 years or so. I haven't had to modify it, so this is great. And I've had great success with this. So again, I have sent it out to George and people here. So if anyone wants, you can send it out to people. Oh yeah, just on the last line, the whole grains. So instead of wheat, what are the other grains you could eat? These are quinoa, amaranth, buckwheat, and gluten-free oatmeal. So those are all okay. I do encourage a lot of like probiotic foods or cultured foods, fermented foods. Try to have 1 serving every day, and maybe it's said that might be equivalent to taking a probiotic. Almost, it's hard to say. Studies have not been done to compare the food and the probiotic. 1 serving of this food, such as miso, sauerkraut, kimchi, kefir, and then mushrooms. I've had success with including mushrooms in the diet, and also by recommending mushroom supplements for certain patients, specific patients. So again, consider eating mushrooms, also cooked mushrooms.
Ghee.
Sorry?
Ghee.
Ghee
Lowers bad cholesterol and
Ghee is okay,
increases
yeah.
good.
Yeah. Again, in small amounts. It's yeah.
How about avocado oil?
Avocado oil?
Yes.
Yeah, you could use avocado oil. You should not be cooking with it, but you could use it, yes.
Okay.
Just a few supplements or foods which I've used or herbs which I've used in my practice. Garlic has been very effective in various different individuals, mainly for cold or other upper respiratory infections. Been very effective in prevention or even in treatment. Haven't found it to be very effective for cholesterol and other issues. Do not take supplements. You could just get the same effect by chewing 2 cloves of garlic every day. And if you do choose to take supplements, garlic or ginger or others, or any other supplements, if you're going in for surgery, you should be stopping all these supplements about 1 to 2 weeks prior to surgery because they all act as blood thinners. Ginger has been also very effective in my practice, and you don't need to take a ginger supplement. There's various ways of taking ginger. You can take it as a tea.
Why is it saying like stop garlic, stop ginger?
These are all blood
2
thinners.
weeks before surgery.
Because they are blood
They're
thinners.
blood thinners.
What?
Blood
They're
thinners.
blood thinners.
Oh, okay.
You don't want to have excessive bleeding at the time of surgery. So ginger has worked for patients with arthritis, even as a tea has been wonderful, along with turmeric, the spice in water. Don't have the recipe, but if you want to write it down, 1 cup of water, you boil that, add 1 teaspoon of turmeric, a 1/4 teaspoon of ginger powder, and a 1/4 teaspoon of black pepper. It's worked wonders for cold, flu, bronchitis, and arthritis. It's been amazing.
How much black pepper?
1/4 teaspoon, yeah. You can drink that 2-3 times a day. Turmeric. We can't talk enough about that. I have all my patients and many staff members, including a few doctors, taking turmeric either in their food or as pills. It's useful in a whole lot of different conditions, such as ulcerative colitis, Crohn's disease. It's an antioxidant, anti-inflammatory agent, antiviral, antibacterial, antifungal, anti-cancer. So almost everybody should be taking it. There's also prevention benefits in decreasing colon cancer, colonic polyps. There's been study in familial adenomatous polyposis where people have hundreds of polyps and they found decrease in the recurrence rate
And
after
what's the
taking turmeric.
dose?
Usually I have people taking 400 twice a day. Some people, 400 milligrams twice a day. Some people need more depending on the underlying condition. Turmeric used with black pepper increases absorption. The black pepper increases the absorption of turmeric by 2,000%. It's very important to use the black pepper. Turmeric on its own is not well absorbed. It's actually poorly absorbed. You have to do something to it. So traditionally in Indian cooking or other Asian cooking, people use oil, the heat, black pepper or other spices are always used, and that's how people used to get it into their body and get the benefit.
And honey.
And honey too is beneficial. For intestinal conditions, take the turmeric without food. You don't want it to be absorbed through. You want it on the lining if you have any intestinal problem. If you want it absorbed internally, you have to have some fat, whether it's from milk or other fat like oil. I've also had success with using turmeric for shingles as a paste. Also, if you have a cut, especially if it's a minor cut, if you have a big cut, you need to go to the emergency room. If you have a minor cut, minor bleeding, take a little pinch of turmeric and just put it on that cut. It's going to stay there until it heals.
What's NFK, KB?
Yes, so I mentioned this before. It's an inflammatory marker, and so this drives, it seems to be driving aging and a number of the conditions related to inflammation, and turmeric inhibits NF-kappa B.
So for shingles, you apply it directly on the
You apply it directly, you
on
can
the
take it
pimples?
internally too, but you can apply it, you should apply it directly.
On the pimples?
Yes, you mix it with water and just apply it directly.
Excuse me, turmeric is a cooking spice, obviously.
Yes.
But curcumin is a derivative in
It's
supplements.
only a part of it, it's one of the main ingredients, but
So-
there's other ingredients in turmeric too.
But with these things, it's cooking first and foremost with it, or supplementing in addition?
I think most people will benefit by cooking with it, eating it, maybe taking the tea, and a few people would benefit from taking the supplement. But with increasing evidence, I have more people taking the supplement in addition to.
And that's what you
Cooking.
meant by the 400 milligrams
Yes,
twice?
correct, yeah.
And with bioperin? Bioperin the black pepper
Yeah,
supplement.
bioperin is derived from black pepper, yeah. There are some newer formulations, I don't know if you're carrying those,
We have
of
phytosomal.
BCM and BCM 95 and phytosomal forms of curcumin, which are better because they're more advanced formulations, they absorb better, because on its own, it's poorly absorbed. Fish oil, there's a lot of benefits to that. Again, you can't spend a lot of time on that. But there are other sources, plant sources of omega-3, such as flaxseed, chia seeds, seaweed, pumpkin seed, walnuts. I encourage people to use all of that. Magnesium is very beneficial for a lot of different conditions, but some of the main ones are for high blood pressure. Actually, I should actually say diabetes too. Migraine, constipation, and stress of any kind.
Insomnia.
Yes. Any kind of muscle pains or arthritis. You take it as a supplement. Also, I encourage you to use it in a bath. Put Epsom salts in a bath and soak it in for
Magnesium sulfate.
Magnesium sulfate, that's correct. You can put it in a bath and soak in it for 15 minutes. It's very beneficial for a lot of.
The acupuncturist once said to take magnesium at night, my acupuncturist, because it processes better when sleeping.
It
Is
should
that
be
true?
taken at night, yes, correct.
That will sit in.
I found it works best when I take it in pre-dawn hours. For me.
Most of my patients say, nighttime works best for them. It helps them to sleep better, and they don't have any other effects from that. Magnesium oxide is the one which is covered by insurance. Medicaid covers that. For some people, that's the only alternative, but magnesium citrate and glycinate might be the better forms of magnesium. They're better tolerated.
But isn't there a problem with magnesium oxide turning into magnesium
Hydroxide, yeah, and it can affect the intestinal lining for some people. So I choose it carefully for certain patients. Probiotics, we talked about that. Prebiotics, also we mentioned. Okay, we had created a pain series. We had a workshop, integrative management of pain, about 2 years ago, and at that time I had created this slide on pain-free diet. If you're having pain of any kind, these are the things you should do. Stop sodas, limit sugar intake, avoid all trans fat, processed foods, avoid all the artificial sweeteners too, avoid MSG. And for some people, certain arthritis, people with certain arthritis, tomatoes, potatoes, eggplants may also be triggers. These are nightshade plants, and they can cause arthritis of certain kinds. Avoid processed red meat, avoid dairy. You can have small ones in your. This is a picture from India. Thank you.